7 Stroke signs you need to know. Stroke is a serious medical emergency that can be life-threatening if not treated promptly. Recognizing the signs of stroke early can help you or a loved one get to the hospital for timely treatment, increasing the chances of recovery and reducing the risk of disability. 1. What is a stroke? A stroke, also known as a brain attack, occurs when the blood supply to the brain is interrupted, either due to a blockage ischemic stroke or a rupture hemorrhagic stroke. This results in brain tissue damage, leading to neurological symptoms. 2 Causes of stroke. There are 2 main causes of stroke. Ischemic stroke. This is the most common type, occurring when a blood clot or plaque blocks an artery in the brain, reducing or completely stopping blood flow to the brain. 2 Causes of stroke. Hemorrhagic stroke. This happens when a blood vessel in the brain bursts, causing bleeding into the brain. 3. 7 Stroke signs to look out for. To remember the warning signs of stroke, use the acronym FAST, which stands for Face. Does one side of the face droop or feel numb? Is it difficult to smile or wrinkle the forehead? Arms. Is one arm weak or numb? Can you raise both arms at the same time? 3. 7 Stroke signs to look out for. Speech. Is speech slurred or difficult to understand? Is it hard to speak or repeat a simple sentence? Time. If you notice any of these signs, call emergency services immediately. Every minute counts as brain cells are dying due to lack of oxygen. 3. 7 Stroke signs to look out for. Besides these 4 key signs, other symptoms could indicate a stroke. Sudden severe headache. A severe headache that's different from usual headaches. Dizziness and loss of balance. Feeling dizzy, lightheaded, or losing balance suddenly. 3. 7 Stroke signs to look out for. Sudden vision loss. Losing vision in one or both eyes, or experiencing blurred vision. Difficulty swallowing. Difficulty swallowing, feeling like food is stuck in your throat. 4. Risk factors for stroke. Several factors can increase your risk of stroke, including age. The risk of stroke increases with age. High blood pressure. High blood pressure is a leading risk factor for stroke. Diabetes. Diabetes increases the risk of stroke by damaging blood vessels. 4. Risk factors for stroke. Smoking. Smoking increases the risk of stroke and other cardiovascular diseases. Excessive alcohol consumption. Excessive drinking can increase the risk of stroke. Overweight or obesity. Being overweight or obese increases the risk of stroke. 4. Risk factors for stroke. Lack of physical activity. Physical inactivity increases the risk of stroke. Family history of stroke. If you have a family history of stroke, you are at a higher risk. 4. Risk factors for stroke. Other cardiovascular diseases. Cardiovascular diseases like coronary artery disease, atrial fibrillation, etc., can increase the risk of stroke. 5. How to prevent stroke. To reduce your risk of stroke, you should control your blood pressure. Maintain a healthy blood pressure by making lifestyle changes, healthy eating, and taking medication if needed. 5. How to prevent stroke. Control blood sugar levels. If you have diabetes, follow your doctor's treatment plan to control your blood sugar levels. Quit smoking. Smoking is a major risk factor for stroke, so quitting is essential for your health. 5. How to prevent stroke. Drink alcohol in moderation. Limit your alcohol intake or avoid drinking altogether. Maintain a healthy diet. Eat a balanced diet rich in fruits, vegetables, and whole grains, and limit salt, saturated fats, cholesterol, and sugar. 5. How to prevent stroke. Exercise regularly. Regular physical activity helps control blood pressure, blood sugar levels, weight, and reduces your risk of stroke. Get regular checkups. Regular checkups can help identify risk factors for stroke early and manage them effectively. 6. Stroke treatment. Stroke treatment depends on the type of stroke and its severity. Common treatment methods include clot-busting medication used in ischemic strokes to dissolve the blood clot and restore blood flow to the brain. Surgery may be performed to remove a blood clot or repair a ruptured blood vessel. 6. Stroke treatment. Rehabilitation. After treatment, stroke patients often need to participate in rehabilitation programs to regain lost functions, such as speech, walking, and movement. 7. Important notes. If you or someone you know suspects a stroke, call emergency services immediately. Every minute counts, and brain cells are dying due to a lack of oxygen. Be aware of the signs of stroke and educate others about them to recognize and respond to this medical emergency promptly. 7 important notes in conclusion. Stroke is a serious but preventable condition. Take proactive steps to protect your health by controlling risk factors and maintaining a healthy lifestyle. If you suspect a stroke, call emergency services immediately for timely medical intervention.